Life-saving healthcare with a focus on the patient's quality of life. It's called palliative care.
Okay, so this time of year can bring up a lot of emotions for patients and their families. Dr. Cari Lowe and Reverend Lorie Nielson are here to tell us more. Both of you are with U of U Health. Thank you for being here this morning. We appreciate it. Let's define palliative care, first of all, if that's okay. What is that? What does that mean?
Of course, and thank you so much for having us. So palliative care is really specialized health care for patients living with serious illnesses and their families, where really our goal is simple, is to alleviate the stresses associated with illness and its treatment. We know that whether it's cancer or advanced heart disease or kidney disease, that affects every aspect of a patient's life. It may be physical, emotional, spiritual, or relationship-wise. And so we get to bring together a big team of experts. It's doctors and nurses, advanced practice providers, social workers, and chaplains like my colleague Lorie, where we all get to work with your treatment specialist to make sure we're addressing each of those issues. I like to say we're a support team for patients at any age and at any stage of their illness to help them live well through their illness, feel better through their treatment, and feel well enough to do the things that bring them joy.
Is there wide use of this approach now, or is it something you're trying to build upon?
Yeah, I wish there was more use of palliative care, and that's why I'm glad that we're here for National Palliative Care Month to really raise awareness of the benefits that we bring for patients and families.
Reverend Nielson, you're a staff chaplain. Talk about what that means for those who aren't familiar. Maybe they haven't had to interact with you at a hospital.
Being a chaplain is just amazing, and it is taking care of anybody and everybody. I see people that have religious traditions and people that do not have religious traditions. People, just as being a human, you are spiritual, and it's what gives your life meaning and purpose. And really, when you come into a hospital setting, that is, some of those things are challenged, and you may be having a different stage of life, or you may have news that is going to change your life, and how you orient to that can be impacted by what your beliefs are, what you practice, and also what gives your life meaning and purpose.
And how do you fit into that palliative care, network, that team, basically?
As part of the team, I go in, and it's a creative process of coming alongside. So where the providers, they have incredible information of taking the big scope of all the different treatments that are being taken care of for the patient. I go in, I'm taking the big picture of the person, and I'm looking for what, if at this time there is something in their life that is being challenged, and when they're in this scared state sometimes, or a transition, or maybe it's because they're looking at their immortality. There's a quote, our relationship with our mortality is at the essence of our spirituality. And as someone that's alive, we all are eventually going to be faced with our mortality, and it can change how we live our life. And I get to be in that arena with people, and it's an incredible honor.
Now, you mentioned you see all kinds of patients, but is it more maybe cancer patients, someone who's kind of staring maybe their mortality right in the face?
So I think that's a great question. So again, I like to say we're any age, any stage of illness. We do see a lot of patients with cancer, but we see a lot of patients with advanced neurologic conditions like Parkinson's and dementia, advanced heart, liver, and kidney disease, where really we get to do three main things. And the first piece is we get to treat symptoms. So when patients have their pain, their nausea, their fatigue, and their mood-related symptoms better, they can do activities that bring them joy and be more active. We also get to help them navigate really complicated healthcare systems. We know that those are overwhelming, and it's our job to help make sure all their doctors are talking to one another.
And speaking of that, what about insurance coverage? It sounds like this is a broader approach to medicine. It involves more doctors, maybe more expenses.
Yeah. So the great news is that palliative care is covered by insurance. So just like any other specialist that you would see, we are part of that team and get to work alongside those teams, and their care is covered.
Now, I have heard, when you hear the term palliative care, some have assumed that this is end of life. This is not you coming back from an illness. Can you talk about that assumption?
Yes, so that's a misperception that's pretty common actually out there. So really palliative care I think of as a great big umbrella. So we're there for patients at any stage of their journey, including folks who actually are going through curative treatment and get to follow into survivorship. There are times that part of that journey does move towards end of life, and we get to care for those patients as well. So really, we get to do the entire spectrum.
So you're I guess, the medical director. What's your expertise in medicine?
So I'm trained as an internal medicine doctor, and then I have a fellowship in hospice and palliative care.
And then Reverend Nielson, when you talk to patients, like you said, some with religious beliefs, some not, what's their initial reaction? Are some skeptical of you? How can you help me, I guess, maybe? Do they wonder that?
First question often, what is a chaplain? And a lot of people don't know. And also, like, I'm already this religion. And a big part is that I let them know that I'm here to support them. I can either be a conduit between their care here at the hospital and making sure we're taking care of the whole person. And I can also help them set them up with, like, obviously if they're asking for a priest and I walk in the room, it's probably obvious I'm not a Catholic priest. But what I can do is help connect them with that. And also that opens up a conversation about how is your spirituality and what is being challenged, and also how can we make sure we're supporting that. And for some people it is literally outside. You know, maybe someone is really religious, but actually what supports their spirit is nature, and you're in a hospital room. And so it can be even being an advocate for the room that they are in, the orientation of their bed, so that they actually can connect to their deeper part of themselves in order to meet their medical situation at the moment.
Let's say if you are a patient, you request your help, and I guess on the other side of it are medical people becoming, I guess, more involved in bringing these resources together.
I think both with palliative and with chaplaincy that so with palliative it's a referral source, and I cover ICUs, plus I also cover, I'm the palliative chaplain, and so I both round on people, and then also by building relationships with the staff I am referred. So it's a combination of being referred and rounding and checking in to make sure we're not missing something. So if you're in the hospital and I never ask you, do you have a faith tradition or anything that's important to support you? We don't ask, then we may not even know that we're missing something really important that's part of who you are. And it may be a ritual. It may be actually transitioning from a medical approach to taking care of you to the spiritual approach.
And it goes without saying that, I mean, pain as part of treatment, it's so hard to deal with for so many people. It doesn't matter what type. So this is key to helping people. Well, Dr. Cari Lowe, Reverend Nielson, thank you so much for being here this morning. We appreciate it.
Yeah, appreciate what you do.
Thank you so much.